The heart monitor's piercing shriek cut through the sterile air, like a blade through silence. Caleb Greene's 12-year-old body convulsed against the gurney restraints as two uniformed officers grabbed his arms, their badges glinting under the harsh fluorescent lights of Children's Memorial ICU. "Get up! Faker!" Officer Martinez barked, his voice echoing off the mint green walls. "We know you're just looking for free meds." The boy's chest heaved in desperate, wheezing gasps. His dark skin had taken on an ashen undertone, beads of sweat forming across his forehead despite the air conditioning. The oxygen mask fogged with each labored breath, but his eyes remained alert, wide with terror as the officers yanked him upward. "Please," he whispered, the word barely audible through the plastic barrier. "Can't. Breathe." "Save the act for someone who cares," Officer Rodriguez snapped, his partner nodding in agreement. The two men wore the distinctive navy blue uniforms of the Harbor Oaks Association security force, their department patches prominently displayed. Rodriguez pulled out his phone, angling it toward Caleb's face. "Smile for the camera, kid. This is going straight to social media. Another insurance scammer exposed." Caleb's mother, Diana Greene, sat in the corner chair where she had been keeping vigil for the past 18 hours. Her scrubs were wrinkled from sleeping in the hospital, her natural hair pulled back in a hasty ponytail. She worked double shifts as a certified nursing assistant at the county hospital across town, barely making ends meet on her salary. Her hands trembled as she watched the officers manhandle her son. "Ma'am, you need to control your child," Martinez said, his tone condescending. "This is a medical facility, not a playground for attention seekers." Diana stood slowly, her voice steady despite the fear coursing through her veins. "My son has severe asthma, complicated by obesity-related respiratory issues. He was admitted yesterday after collapsing at school. The pulmonologist is supposed to see him this morning." "Right," Rodriguez scoffed, scrolling through something on his tablet. "A 12-year-old who weighs 200 pounds suddenly can't breathe. Convenient timing, especially when the insurance paperwork shows a family income barely above the poverty line." The accusation hung in the air like a toxic cloud. Caleb had struggled with his weight since age 7, when the asthma medications began affecting his metabolism. The steroids, necessary to keep his airways open, had triggered excessive hunger and weight gain, creating a vicious cycle that no amount of dietary changes seemed to break. Diana had explained this to countless doctors, teachers, and now, apparently, police officers who thought they understood medicine better than medical professionals. "He's been seeing specialists for years," Diana said, her voice rising slightly. "Dr. Patterson at Children's Respiratory Center has been managing his case since he was 8. We have documentation." "Documentation can be faked," Martinez interrupted. "What we have here is a pattern of healthcare fraud. Kid comes in claiming breathing problems, gets expensive tests, maybe some prescription drugs to sell on the street. We've seen it before." Caleb's breathing became more labored, the wheezing sound intensifying. The pulse oximeter clipped to his finger showed his oxygen saturation dropping into the low 80s. A normal reading should have been above 95%. The machine's alarm began beeping insistently, joining the cacophony of medical equipment surrounding his bed. Nurse Patricia Williams rushed into the room, her 20 years of pediatric experience evident in the way she immediately assessed the situation. She moved past the officers without acknowledging them, checking Caleb's vitals and adjusting his oxygen flow. "His stats are dropping," she announced, her professional demeanor masking the concern in her voice. "He needs to stay on continuous monitoring." "Not anymore," Rodriguez said, producing a set of official-looking papers from his jacket pocket. "We have authorization from the Harbor Oaks Association Medical Review Board to remove this patient from active care. He doesn't meet the criteria for emergency treatment." Nurse Williams scanned the documents, her frown deepening. This isn't how medical decisions are made. Where's Dr. Patel? He's the attending physician. Dr. Patel has been notified of our investigation. Martinez replied smoothly. Hospital administration is cooperating fully with our fraud prevention initiative. The lie rolled off his tongue with practiced ease. In reality, the officers had received a complaint from an anonymous source, claiming that certain patients were gaming the system, using fake emergencies to obtain narcotics or avoid paying for legitimate medical care. The Harbor Oaks Association, a wealthy enclave surrounding the Children's Hospital, had grown increasingly vocal about healthcare costs and insurance fraud. Their privately funded security force had been granted expanded authority to investigate suspicious activity in public facilities within their jurisdiction. Caleb tried to speak, but the words came out as gasps. His lips were beginning to show a bluish tinge, a clear sign of oxygen deprivation. Diana moved toward her son, but Officer Rodriguez blocked her path. Step back, ma'am. We're handling this situation. You're not medical professionals. Diana's composure finally cracked. You can't just decide who gets treatment. We can, and we will, Martinez said, beginning to disconnect the monitors from Caleb's body. The boy's eyes widened in panic as the oxygen mask was pulled away from his face. This kid has been taking up a bed that could be used for actual emergencies. The heart monitor flatlined as Martinez unplugged it. The sudden silence, more ominous than the alarms had been. Caleb's breathing became even more shallow, his chest barely rising and falling. Nurse Williams reached for her phone, but Rodriguez quickly intervened. No unauthorized communications, he said, confiscating the device. This is an active investigation. They began wheeling Caleb's gurney toward the door, ignoring his mother's protests and the boy's increasingly desperate attempts to breathe. The hallway outside the ICU was bustling with morning activity. Doctors making rounds, nurses distributing medications, families visiting loved ones. The sight of a child being removed from intensive care by security officers caused immediate attention. Where are you taking him? Diana demanded, following closely behind the gurney. To a holding area where he can be properly evaluated for insurance fraud. Martinez replied without looking back. And, if you continue to interfere with our investigation, you'll be arrested for child endangerment. The threat sent a chill through Diana's body. As a single mother working in healthcare, she understood the gravity of any criminal charges. Even an arrest without conviction could cost her job, her nursing license, and, ultimately, her ability to care for Caleb. The officers knew this, using her vulnerability as leverage to maintain control of the situation. They positioned the gurney in a corner of the general waiting area, away from the medical equipment and monitoring devices that had been tracking Caleb's vital signs. The boy's breathing continued to deteriorate, his skin taking on a grayish pallor. Other patients and families in the waiting room began to take notice, whispering among themselves about the unusual scene. This is medical neglect, Diana said, her voice carrying across the space. My son needs oxygen therapy. He has a documented medical condition. Your son needs to learn that there are consequences for fraud, Rodriguez replied, pulling out his phone again. This time, he positioned it to capture both Caleb and Diana in the frame. Say hello to the internet, folks. Another family trying to scam the healthcare system. He began recording, narrating the scene as if he were documenting a criminal arrest. Here we have a 12-year-old male who claimed to be having breathing difficulties. No evidence of actual respiratory distress upon closer examination. Mother appears to be coaching the child to maintain the deception. Caleb's eyes rolled back slightly as he struggled to maintain consciousness. The lack of supplemental oxygen was taking its toll, his body fighting to extract enough air from the environment to sustain basic functions. Diana reached for his hand, but Martinez stepped between them. "No contact with the subject during our investigation," he said firmly. The elevator at the far end of the corridor dinged softly, its doors sliding open to reveal a woman in a sharp, charcoal business suit. Senator Viola Greene stepped out, her presence immediately commanding attention even before anyone recognized her. At 58, she carried herself with the confidence of someone who had spent decades navigating the corridors of power. Her natural hair was styled in a professional afro, and her dark eyes surveyed the scene with the analytical gaze of a seasoned prosecutor. Viola had been visiting pediatric patients as part of her regular community outreach program, bringing books and educational materials to children facing long hospital stays. As the chair of the Senate Judiciary Committee, she maintained a visible presence in her home district, particularly in healthcare facilities that served vulnerable populations. The senator's eyes locked onto the gurney in the corner, recognizing the familiar features despite the distressed condition of the boy lying there. Caleb Greene was her nephew, her younger brother, Marcus's son. She had been supporting Diana financially since Marcus died in a construction accident 3 years earlier, though she tried to do so discreetly to avoid drawing unwanted attention to the family. "Caleb." Viola's voice cut through the ambient noise of the waiting room. She moved quickly toward the scene, her heels clicking authoritatively against the polished floor. Officer Rodriguez looked up from his phone, recognizing the senator, but not immediately connecting her to the situation. "Ma'am, this is an active investigation. We need you to maintain distance from the subject." The subject, Viola's voice, carried the edge of someone accustomed to cross-examining hostile witnesses. "That subject is my nephew." The words landed like a thunderbolt in the crowded waiting room. Rodriguez's phone slipped slightly in his hand as he processed the implications. Martinez, who had been preparing to move Caleb to a more isolated location, froze mid-step. "Senator Greene," Diana said, relief flooding her voice. "They're saying Caleb is faking his asthma attack. They won't let him have oxygen." Viola's eyes swept over the scene, taking in every detail with the precision of a trained investigator. Her nephew's labored breathing, the missing medical equipment, the officer's defensive postures, everything painted a clear picture of medical neglect and potential civil rights violations. "Officers," she said, her voice deceptively calm, "I need to understand the legal authority under which you've removed a minor from intensive care." Martinez tried to regain control of the situation, straightening his uniform and adopting a more formal tone. "Senator, we're conducting a fraud investigation authorized by the Harbor Oaks Association Medical Review Board. This patient doesn't meet the criteria for emergency care." "The Harbor Oaks Association," Viola repeated slowly, "is a private homeowners organization. They have no legal authority to make medical decisions for patients in a public hospital." Rodriguez pulled out the papers again, extending them toward the senator. "We have proper documentation." "What you have," Viola interrupted, scanning the documents quickly, "is a fraudulent authorization that violates federal patient protection laws, state healthcare regulations, and basic constitutional rights." She pulled out her own phone, speed dialing a number. "This is Senator Greene. I need an emergency legal team at Children's Memorial Hospital immediately. We have officers acting under false authority." While she spoke, Viola noticed something that made her blood run cold. Caleb's breathing had become so shallow that his chest was barely moving. His lips were definitely blue now, and his skin had taken on a sickly gray pallor. She had seen enough medical emergencies during her time on healthcare committees to recognize the signs of severe oxygen deprivation. "This child needs immediate medical attention," she said, ending her call and moving toward Caleb. "Ma'am, please step away," Martinez said. but his voice lacked its earlier confidence. The realization that they had just removed a senator's nephew from medical care was beginning to sink in. "I will not step away from a child who is dying," Viola replied, her words carrying across the waiting room like a pronouncement from the bench. Other families began pulling out their phones, recording the confrontation. Social media posts began appearing within minutes. The hashtag Joshua Caleb Greene trending as the story spread. What the officers didn't know was that Nurse Patricia Williams had managed to activate the hospital's internal live streaming system before her phone was confiscated. The Children's Hospital broadcast educational content and patient stories through various social media platforms as part of their community outreach program. Williams had triggered an emergency broadcast, sending a live feed of Caleb's deteriorating condition directly to thousands of viewers. The stream showed Caleb's oxygen saturation monitor readings from the ICU, which continued to register his vital signs, even though he had been physically removed from the room. Medical professionals watching the feed could see his oxygen levels plummeting to dangerous levels, 68% and falling. Comments began flooding in from healthcare workers, patient advocates, and concerned citizens demanding immediate intervention. Dr. Sarah Patel, the attending physician, burst through the elevator doors after being alerted by the emergency broadcast. She took one look at Caleb and immediately began barking orders to the nursing staff. "Get me an oxygen tank and a transport monitor. Now this patient is in respiratory distress." "Doctor, these officers say they have authority," a nearby nurse began. "I don't care if they have authority from God himself." "Doctor," Patel snapped, beginning to examine Caleb. "This child is hypoxic and needs immediate treatment." Officer Rodriguez made one last attempt to maintain control. "Doctor, we have documentation that this patient is committing insurance fraud." "Are you a medical doctor?" "Doctor," Patel asked without looking up from her examination. "Well, no, but—" "Then you have no authority to make medical decisions." She turned to Senator Greene. "Ma'am, I don't know who you are, but this child needs to be back in the ICU immediately." "I'm Senator Viola Greene, and I completely agree with your assessment. Doctor—" The combination of Dr. Patel's medical authority and Senator Greene's political influence created an unstoppable force. The officers found themselves surrounded by hospital staff, concerned families, and now, news reporters who had been alerted by the viral social media posts. The live stream had reached over 50,000 viewers, many of them sharing the feed with their own networks. As Caleb was rushed back to the ICU, Senator Greene called a press conference in the hospital's main atrium. The space filled quickly with local news crews, hospital administrators, and community leaders. The senator stood at the podium, her presence commanding the room as she prepared to address what had become a national story. "Ladies and gentlemen," she began, her voice carrying the authority of her office, "what happened here today represents a fundamental breakdown of our most basic social contracts. A child's right to medical care was violated by individuals acting under false authority." The cameras rolled as she continued. "My nephew, Caleb Greene, is a 12-year-old boy with a documented history of severe asthma and respiratory complications. Today, he was removed from intensive care by officers claiming to investigate insurance fraud. They denied him oxygen therapy, while his blood oxygen levels dropped to life-threatening levels." Hospital Administrator Jennifer Walsh stepped to a secondary microphone. Children's Memorial Hospital wants to make clear that no external organization has the authority to override medical decisions made by our physicians. The actions taken today were not authorized by hospital administration. Questions began flying from the assembled reporters. "Senator Greene, what legal action will you be taking? How is your nephew's condition? Was this motivated by racial bias?" Viola raised her hand for silence. I have been in contact with the Department of Justice Civil Rights Division. Federal investigators will be reviewing this incident for potential violations of civil rights laws, healthcare regulations, and child protection statutes. She paused, allowing the weight of her words to settle over the room. Additionally, I am calling for a comprehensive investigation into the Harbor Oaks Association's unauthorized medical review board and any other instances where private organizations may have overstepped their legal authority in healthcare settings. As if on cue, the elevator doors opened again, this time revealing two United States Marshals in their distinctive uniforms. They moved purposefully through the crowd, their presence adding another layer of federal authority to the situation. The Marshals approached Officers Martinez and Rodriguez, who had been trying to blend into the background near the hospital's information desk. Officers Martinez and Rodriguez, the senior marshal announced, his voice carrying across the atrium. You are under arrest for violation of federal civil rights laws, reckless endangerment of a minor, and operating under false governmental authority. The arrests were captured by dozens of cameras and broadcast live across multiple networks. The two officers, who had begun the day believing they were enforcing legitimate law enforcement protocols, found themselves in federal custody facing serious felony charges. The legal ramifications moved swiftly through the system. Within hours, federal prosecutors had filed charges not only against the individual officers, but also against the Harbor Oaks Association leadership who had created the fraudulent medical review board. The investigation revealed a pattern of discrimination, targeting low-income patients and families of color, using fabricated concerns about insurance fraud to deny or limit medical care. The Harbor Oaks Association faced immediate federal oversight and massive civil liability. Their attempt to control healthcare access in their jurisdiction had not only violated numerous laws, but had also exposed them to wrongful endangerment lawsuits that threatened the organization's financial existence. Meanwhile, in the ICU, Caleb's condition stabilized under Dr. Patel's care. The specialized equipment monitored his breathing as oxygen therapy helped restore his blood oxygen levels to normal ranges. Diana sat beside his bed, holding his hand as he slept peacefully for the first time in days. He's going to be fine, Dr. Patel assured her during evening rounds. The respiratory specialist will see him tomorrow, and we're adjusting his medication regimen to better manage both the asthma and the weight-related complications. Diana looked up with tears in her eyes. I thought they were going to let him die. I thought because we don't have money, because we're black, because Caleb is heavy. I thought none of that mattered to them. It should never matter. Dr. Patel replied firmly. Every child deserves the same standard of care, regardless of their background or circumstances. Senator Greene visited later that evening, finding her nephew awake and breathing easily with the support of the medical equipment. How are you feeling, baby? She asked, taking his hand. Better, Caleb said, his voice still hoarse but much stronger. Aunt Vi, why did those men say I was lying about being sick? Viola considered her words carefully. Sometimes, adults make very bad decisions based on wrong ideas about people. Those men thought they knew better than doctors about who deserves medical care. They were wrong, and they're going to face consequences for their actions. Will other kids be safe now? Caleb asked, the question revealing a maturity beyond his years. That's what we're working to ensure. Viola replied, what happened to you should never happen to any child. The broader implications of the case continued to unfold over the following weeks. The Department of Justice launched a comprehensive civil rights investigation, examining similar incidents across the country where private organizations had attempted to override medical decisions. The case became a landmark precedent for patient rights and the limits of private security authority in healthcare settings. The Harbor Oaks Association faced not only federal criminal charges, but also a class action lawsuit from families who had been affected by their discriminatory policies. The financial settlement ultimately forced the organization to liquidate significant assets, including several luxury properties that had been used as private clubs for association members. In a gesture that surprised many observers, the association's court-mandated community service included funding a new pediatric pulmonary care wing at Children's Memorial Hospital. The facility was named Caleb's Heir, in honor of the boy whose near-death experience had exposed the systemic discrimination in healthcare access. The new wing featured state-of-the-art respiratory care equipment, specialized treatment rooms for children with chronic breathing conditions, and a family support center that provided resources for parents navigating complex medical situations. Dr. Patel was appointed as the wing's director, ensuring that the facility would operate under the highest standards of medical care and patient advocacy. On the day of the wing's dedication ceremony, Caleb stood beside his mother and aunt as they cut the ribbon. His breathing was stable, supported by a new treatment regimen that addressed both his asthma and metabolic issues. He had lost 30 pounds under careful medical supervision, improving his overall health while maintaining the respiratory support he needed. "This place will help kids like me," he said to the assembled crowd, his voice clear and strong. "Kids who need doctors to listen, not people who think they know better than doctors." Senator Greene spoke last at the ceremony, her words carrying the weight of legislative change that had emerged from her nephew's ordeal. Caleb's experience led to the passage of the Patient Protection and Medical Authority Act, which clarifies that only licensed medical professionals can make decisions about patient care in healthcare facilities. She paused, looking at the families gathered for the dedication, parents with children facing chronic illnesses, community leaders, healthcare advocates, and the medical staff who would operate the new facility. No child should ever have to fight for the right to breathe. She continued, "No family should face discrimination when seeking medical care. This facility represents our commitment to ensuring that healthcare access is based on medical need, not economic status, race, or any other factor that has nothing to do with healing." The ceremony concluded with tours of the new facility, showcasing the advanced equipment and child-friendly environment that would serve hundreds of young patients each year. The waiting areas featured comfortable seating for families, educational materials about respiratory health, and play areas designed to reduce anxiety for children facing medical procedures. Diana Greene, who had been promoted to a supervisory position at her hospital following her advocacy during Caleb's crisis, spoke with other parents about navigating the healthcare system. "Don't be afraid to ask questions," she advised. "Don't let anyone make you feel like your child doesn't deserve care. And remember that you have rights, even when you feel powerless." As the sun set over the hospital complex, Caleb played in the new wing's recreational therapy room, his laughter echoing through the corridors where he had once struggled to breathe. The monitors that had once screamed warnings about his failing vital signs now hummed quietly in the background, providing reassurance rather than alarm. The transformation was complete, from a medical emergency that exposed systemic discrimination to a catalyst for meaningful change in healthcare access and patient rights. The story of a 12-year-old boy fighting for breath had become a movement ensuring that every child's right to medical care would be protected, regardless of who they were or where they came from. Officers Martinez and Rodriguez faced federal prison sentences for their actions. Their careers in law enforcement permanently ended. The Harbor Oaks Association was dissolved as a legal entity, its assets redistributed to support healthcare access programs in underserved communities. The fraudulent medical review board that had authorized the removal of patients from care became the subject of multiple criminal investigations. But perhaps the most significant change was cultural. the widespread recognition that healthcare access should never be subject to the biases or assumptions of non-medical personnel. The case established clear legal precedents, protecting patient rights and limiting the authority of private security forces in medical settings. Years later, as Caleb grew older and his respiratory health stabilized through proper medical management, he would often visit the wing that bore his name. He would see children facing similar challenges to those he had endured, but now receiving care in an environment designed to support both their medical needs and their dignity as patients. The monitors still beeped, the machines still hummed, and children still faced the frightening experience of serious illness. But they did so in a system that had been fundamentally changed by one boy's struggle to breathe, a struggle that had revealed the best and worst of human nature, ultimately inspiring a community to choose justice over discrimination, compassion over suspicion, and healing over harm. In the end, Caleb's story became more than a medical emergency or a legal case. It became a testament to the power of standing up for what is right. Even when the odds seem overwhelming, it showed that a single voice, whether that of a frightened mother, a determined senator, or a brave child fighting for breath, could challenge an entire system and create lasting change. The lesson echoed through the halls of Caleb's air, and beyond. Every person deserves to be heard. Every child deserves protection. And every breath matters in the ongoing fight for justice and human dignity.